Good afternoon, everyone. Okay, thank you so much, Vanessa, David, Lucy, and the rest of the team for the invitation. I'm so much glad to be here. As I've been introduced, I'm Jimmy. I work at Nkaiwuatei of SAS Africa. And I just would like to give a brief introduction about Nkaiwuatei of SAS Africa before we proceed. And we can move on to the next slide. Okay, so this is what I'll be talking in the next very few minutes because I've been told do not have much time and I might be punished for that. So I don't want to be invited and get punished. Okay, then next slide. Okay, so about the Nkaiwuatei of SAS Africa, it's a youth-led initiative, and we focus mainly on empowering the young people to be active advocates against antimicrobial resistance across the African continent. And we do focus on the community engagement programs as well as research against antimicrobial resistance. So this is a programs, part of our programs that we implement as an organization. We do empower other students, tertiary level students across Africa. Here, for example, we have the NOBSA team, and I can see, I think, Sylvanus is here, and maybe, I think, maybe you are part of the team, And in the second picture, you can see one of our advocates at the grassroots level. That is the community engagement programs on AMR. Okay, nice. Next step. Before, I just want to mention about the research discovery innovation program. We also have the do some basic research as well as implementation research on antimicrobials, data generation on meta-analysis of research, mainly on AMR and antimicrobials. We also have the AMR writers and content creators program, and this is very much important when it comes to AMR as we involve the social scientists on AMR. It's I think communicating AMR has been a very big challenge because I think it has been I think somehow neglected, especially for the non-medical professionals. So that's why we wanted actually to incorporate those professionals, the students who are outside the medical field, to foster their skills and knowledge on how we can communicate on AMR among the community. Yes. Next slide, please. So I've talked about Nkaiwuatei of SAS Africa. So if you have more questions on that, you can meet me after the presentation. So let's now get to the next part of this. That is the climate change. And I won't talk much about the climate change, the introduction. We all know that. Dr. Nasri mentioned that she won't be talking much about mental health because we always hear about mental health every day. Same case to climate change, we hear about it every day. So we can move on. Thank you. Next slide. Okay. As you can see here, since the pre-industrial period, the anthropogenic activity, that is human-driven activities, has been the major factor attributable to the growth of or development of or occurrence of climate change, or maybe we can say global warming. And this has been increased to as global average temperature by 1 degree Celsius. And currently it is estimated by rising to about more than 0.2 degrees Celsius in a decade. This could be very much dangerous. As you can see in the picture here, this is a study indicating that in the rise of the global warming, we can see the previous years. Actually, we can see that the rise in temperature was at the negative values. But as we move along, currently we can see at 2020, this data was done in 2020. But you can see where we are at the moment. You can imagine where we will be in the next 2 years, 10 years, or in the next century. So it's our role as a current generation to take care of our planet for the betterment of the next generations and even the current generations. Thank you. Next slide. So also about as an AMR advocate and antimicrobial resistance advocate. Let me mention something about the nexus between climate change and vector-borne diseases, which I think have also been mentioned by the previous speakers, and I wanted to mention about that. And we can see in the first picture now, we can see the color scale here. It's an indicative of the survival and transmission capability of the vectors in terms of in reference to global warming. We can see in the first picture, we can see maybe in the early 2000s, global warming was a very low scale or value. But going to the 2050s, or maybe even the current before 2050, 2020, we can see it starts rising. So maybe even in the next 10 years, 20 years, or even the next century, it will be somehow very much catastrophic. And looking at this, the effect of climate change on the vector-borne diseases, that is the infectious diseases, how these climate change affect all these, the environment that we live in. Maybe, for example, the habitat, destruction of habitat by this, by the changing climate change, it has led to increased exposure of human beings to these vector-borne diseases. For example, mosquitoes we can see here, zoonotic diseases, which has been mentioned by, I think, Ojito, yes. And at the same time, destruction of vegetation and plants, which is another important habitat for these vector-borne diseases. So an increase in vector-borne diseases, or increase in global warming or temperature, has increased this exposure of human beings to infectious diseases and vector-borne diseases. Yeah, next slide. Here we will talk about climate change and disease outbreaks and what could be the next or the way forward to this. Next. Okay, nice. So, yeah, it's okay. So first, we could go back, click on nice, thank you. So the first one is what will be the way forward? First, we employ system-based approaches and process-based models that incorporate meteorological, health, engineering, and environmental data. We all understand that climate change is, we need to understand climate change as a system. So how can we develop interventions to climate change in a way that we can mitigate as a whole? Yeah. Next slide, please. Another way that we can approach or mitigate the climate change is integrating a value system like biological, social engineering approach on climate change. We also understand the nexus between climate change, human beings, social and environmental drivers of climate change. We need to understand this. How can we integrate all these players of climate change in a biological way, social drivers, and climate change? That is the only way we can drive effective solution against climate change. Next. Another very important factor that we need to mention is about modeling, climate change modeling, which can help us also to predict the effects of climate change on our planet. At the same time, it can also help us to predict the interventions, the impact of the interventions on climate change. So by doing this, we'll be able to see maybe when we intervene in this way, or maybe through biological, social, and environmental approaches, this could be the outcome of this. Yeah, next. Another very important approach, that's a public-private partnership to increase the resilience of system, including through investments in disaster risk reduction and effective service delivery to the underserved. So we can also, I think, maybe I can mention that even climate change, as far as it's a global issue, we are not so much affected by climate change at equal measure. We all have those that are at a very high risk or highly vulnerable to climate change compared to us, as maybe we can say the African region and maybe the global north. We're not even at risk at equal measure. So how we can be able to create this private and public partnership in a way that we can offer services to the most vulnerable in the community, or even when it comes to disease mitigation approach and the effect upon diseases, how can we be able to do this in a more effective way? Next. The last one is the development of climate change action plans on disease outbreaks. So we've seen the nexus between climate change and the environment, infectious diseases. So how can we, it's very much important if we have the plans. In the AMR sector where I work at, I think, there's a lot of development in the AMR national as well as global national plans on AMR. But at the same time, maybe even if we have global climate action plans on the climate disease interface, I think this could go a long way in providing a solution to climate change mitigation. Yeah, next please. Okay, so as the young people, what is our role, especially the healthcare workers, in working or integrating climate change in health? And we can see, as the young people, it's very much important to integrate public health promotion with climate change awareness through education outreach initiatives. So we've seen that we're doing a lot on awareness as well as education. But I think, have you been doing much on climate change? Maybe we need to put more emphasis on that. So it's also important, maybe as we do public health or community health awareness, we need to incorporate this with the climate change. Yes, next. So advocating for policy changes for the reduction of carbon footprint in the healthcare sector. And we also understand that the healthcare sector is another very key player in, as far as the climate change is concerned. How is it contributing to climate change through maybe, for example, biopharma, or maybe through incineration? What role can we do as the young people? Can we do, or maybe advocate for other intervention measures to do this way in sustainable measures to reduce the carbon footprint, carbon footprint in the healthcare sector? Yes, I think we can do through advocacy for policy changes. That one is a partnership and collaboration with highly experienced healthcare and other relevant professions in the field of climate change, as well as maybe even healthcare. So through this, we will be able to share knowledge and even develop sustainable measures to climate change. Yeah, next. And of course, let me mention about research, innovation and evidence generation. So without research, we cannot be able to develop these measures that we are talking day in, day out. We are looking for innovations. How can we adapt to climate change? But we can't do that without research. Thank you. Next. So now my question is, should we move from climate change mitigation to climate change adaptation, and why? Possibly. I'll request to have three questions, three answers, maybe from this end, and the back. Can we? Because of time? Yeah.
She had a question, so I think we'll reserve it for the Q&A. Anyone
Okay. We have someone at the back. Take it back. There also, it's someone from this end. Yeah, maybe the second row, that. Yeah.
Thank you for your question. I think I'll speak in the Kenyan perspective. because of the effects that we are facing as a country, we need more adaptation strategies so that we can have communities stay resilient. But because we are also emitting a certain percentage, especially in the healthcare system that we have, then we need to also have an aspect of mitigation. So I think a cross-cutting issue will do.
Thank you. That's nice. One more to go.